Hello everyone, today I'm going to talk about neurology, one of the most fascinating specialties in medicine. First, what's the name of my medical specialty and what does it focus on? Neurology is a branch of medicine that studies the nervous system and its diseases. The nervous system is like the body's command center and it has three main parts. The central nervous system with the brain and spinal cord, the peripheral nervous system with cranial and spinal nerves, and autonomic nervous system, which controls involuntary functions like breathing, digestion, and heart rate. Second, what kinds of patients or health problems does this specialty treat? Neurologists see patients with all sorts of nervous system disorders. Things like strokes, epilepsy, dementia, multiple sclerosis, neuromuscular disorders, and even infections like meningitis or encephalitis. They also treat more common problems such as chronic headaches or neuropathic pain. What are the main responsibilities of doctors in this field? The main role is to diagnose, treat, and follow up on diseases of the nervous system. They do this with both clinical exams, like checking reflexes, strength, coordination, and sensitivity, and advanced studies such as MRI, CT scans, EEGs, electromyography, PET scans, or cerebral angiography. Thanks to these tools, neurologists can detect conditions earlier and improve patients' outcomes. Then, what procedures, tools, or technologies are commonly used in this specialty? Neurology makes heavy use of imaging and functional tests. For example, MRI and CT scans show brain structures. EEG records brain waves, and electromyography evaluates muscles and nerves. Each tool gives different information, and together to provide a complete picture of what's happening in the nervous system. Why is this specialty crucial in medicine nowadays? Because it deals with the brain, spinal cord, and nerves, the systems that control everything else. Neurological diseases are increasingly common today, especially as populations age. Conditions like Alzheimer's, Parkinson's, multiple sclerosis, stroke, and epilepsy not only affect health, but also change family and social dynamics. Neurology also connects with other specialties like psychiatry, neurosurgery, and rehabilitation, making it a central field in modern medicine. There are some interesting or surprising facts about this specialty. Here are a few. The human brain has about 86 billion neurons, each forming thousands of connections. The brain itself has no pain receptors, which is why neurosurgeons can sometimes operate on awake patients. Neurological symptoms can be tricky. For example, a seizure may look like fainting, or a stroke can look like a simple dizziness. And finally, neurological diseases don't just affect patients, but also their families. For instance, Alzheimer's can completely reshape daily life relations. A short story or fun fact related of my specialty. One of the most famous cases is Phineas Gage. In 1848, an iron rod went through his skull and brain in a work accident. He survived, but his personality completely changed. He became impulsive and aggressive. This case showed for the first time that specific brain regions, like the frontal lobe, are linked to personality and behavior. So, neurology is not only about treating diseases. It's about understanding how the nervous system makes us who we are. And that's what makes this specialty so important today. Thanks for your listening.